I was in several car wrecks. I got a herniated disc. We did epidural blocks. I went to a neurologist for 5 years. He always gave me a lot of medication to mask. It got rid of my symptoms, helped me, but I always had the symptoms there. Then they started doing epidural blocks. I went to a neurologist here, and he more or less made me out to be a hypochondriac, because he couldn't help me. And I went in one day, talked to him. I've been coming to you for 5 years. I'm no better. I thought we'd put our heads together and talk. Instead, he started yelling at me and getting really angry with me, so naturally I got up and I left. My son, who is a workman comp attorney, got me another doctor in Atlanta, another neurologist to go see. He ran tests on me and he told me I have a herniated disc and I need surgery. So he went in and we moved bone out of my pelvic and repaired that disc and told me I'd be fine. I went ahead and had the surgery because I was in so much pain. I didn't think I could be any worse. I was 2 and 3 migraines a week, headache 24 hours a day, 7 days a week, managed from 1 to 10. 1 being I knew it was there. The medication helped me. 10 would be a migraine. Maxalts was the only way to get rid of, or Zomix, get rid of my migraines. I lived on BC, basically, to survive again with my headache. And again, it never totally got rid of it. In '05, January, I had surgery when I had that done. By September of '06, my migraines are back, my headaches are back. I then go see a pain specialist, and I know I herniated another one. I never saw any benefit relief from the surgery. And so he put me in for another MRI, and I had herniated another one. He said, basically what happens, if I keep having surgeries, I'll end up with a whole rod in my neck, and I won't be able to drive or do anything. I won't be able to turn my head up, down, or sideways because of the rod. And I don't want to live my life that way. And so he put me on methadone and started giving me epidural blocks. And then it got rid of my migraines for a while and my neck pain for a while, but they always came back. Then I tried to get off of methadone. I spiraled out of control. And so my husband tried to get me with other doctors. I finally got another pain specialist who helped me get off. But then my migraines came back full force. Nothing would help me, not even a Maxalt. You can only take 2 in 24 hours. Within 4 hours, I had 2 in me, and being 10 at the highest, it only brought it down to a 5. I called that doctor back. He said, I'm sorry, but you have to go back on methadone. It's the only way to get rid of it. And it did get rid of it. But my neck pain was still back. I didn't know what to do, and my insurance had run out. My rates were going way up, and he now won $250 just to see his assistant just to get my medication. I was doing 60 milligrams a day of muscle relaxants. I was doing methadone, 5 milligrams in the morning, 5 milligrams at night, and living on Midrin, which is a prescription headache pill. And meanwhile, I also developed ulcers from all the BC I was taking, because the doctor also gave me inflammation pills that burned a hole in my stomach. So, long story short, I started looking in the phone book for someone else, because I can't afford $250 a month just to get my prescriptions. That's not even seeing the doctor, that's not getting treated, that's not anything. And I found your ad, Dr. Snyder on it. I called, and they told me my first visit I could come in and he would just talk to me. It would be no charge. And I couldn't believe it. So I made the appointment, came in, talked with them. They found out I didn't have insurance, and they worked with me on price, and basically charged me half. And it works out to be less than what I was going to be paying my physician assistant just to get my medication. I've only had 4 migraines since January. I no longer take muscle relaxants. Once in a blue moon, my neck might ache on me real bad, and I'll take one to go to bed to sleep. I now take Excedrin over the counter, 1 Excedrin, to get rid of my headache. I actually go a whole day with no pain in my neck or my head. But I do have bad days once in a while. I still will get a migraine. I've had 4, and I've had to take Maxalt twice. But usually 2 Excedrins, tension, relaxant, will get rid of that, and I just go on my way. I feel a whole lot better, and I've been seeing Dr. Snyder twice a week for my treatments, and I plan to keep coming. My husband's seen my energy levels come back. I'm back to working like I was. I'm back to feeling more like my old self. Basically, that's it.